In today's video, we're going to be going over Medicare Advantage and Medicare Supplement. This is going to be your complete guide on what's the difference between Medicare Advantage, Medicare Supplement, all the pros, all the cons, and everything in between. So let's get right into it. So when you're first eligible for Medicare, you're going to have to apply for two different parts of Medicare. Number one is Part A. Now, Part A typically won't cost you anything per month to have because you worked 40 quarters or 10 years. Now, this is also what they call your hospital coverage. So this is going to cover anything hospital related. Now, we're going to just do an overview today. We're not going to get in super far into the weeds with Part A and Part B, but Part A, all you need to know is that it's going to be your hospital coverage. And like we said, it's typically not going to cost anything per month to have because you already paid your taxes for 40 quarters or 10 years. The second part that you absolutely have to apply for when you turn 65 is what they call Medicare Part B. Now, Part B is your medical coverage. For 2025, the average senior is going to pay the standard Part B premium for their Part B, which is $185 a month next year in 2025. Refer to this chart right here because some people that are higher income earners actually have to pay more than this $185 a month. So refer to this income chart, make sure that you're just gonna pay the standard, or if you are a higher income earner, make sure that you budget the right amount according to your income. Okay, so now that we got that taken care of, this is what I like to call the starting point when it comes to Medicare. A lot of individuals will enroll into Part A and Part B and they'll think that's all that they have to do and then they don't have to do anything else. I believe that couldn't be further from the truth because like I said, this is the starting point. It is definitely not the finish line. So, and you'll understand that after you watch the next few minutes of this video. But for simplicity, Part A and Part B are what they call original Medicare or traditional Medicare. If you've ever heard anybody say original Medicare or traditional Medicare, this is exactly what they're talking about, Part A and Part B. Now, like we said before, I'm not going to get super far into it, so we're going to do an overview. Part A and Part B roughly are going to pay about 80% of all your medical and hospital bills. Now, you will have a deductible with Part A, but we're gonna just flat number we're gonna use is 80% of your bills are gonna be covered if you only had Part A and Part B. Now, obviously, that is a huge gap in coverage, having to pay 80% of all the bills that you get in the mail. So what they have done for Medicare is they have made two options of covering this 80%. And those two options, the first one is what they call Medicare Advantage. Now with Medicare Advantage plans, they are going to be very similar to like an employer plan you might be on through work or private insurance that you may have currently. Now, typically with Medicare Advantage plans, some things that you need to know ahead of time is there's not most of the time not going to have any type of premium. So it's going to be what they call a $0 premium plan, meaning there is no monthly cost to get on one of these plans. But what you're going to do instead, since you're not paying it ahead of time, you're going to pay as you use the plan with what they call copays. So you'll have copays when you go to the doctor's office, specialist visit, you get a surgery done, you stay in the hospital, and they can drastically change depending on what state that you live in. Some states, they have very, very good Medicare Advantage plans. In other states, they're more of a Medicare Supplement option, which is the second option we're gonna go over. So it's very important to do your research on your specific state and what plans that they have available to you. Now with Medicare Advantage, you're gonna wanna know a few different things. So one, there are doctor and hospital networks that you have to stay within. So you can't just go to any doctor or any hospital in the country. There are specific ones that you have to see depending on what insurance carrier you take for your Medicare Advantage plan. Now, along with that, there's also going to be a few extra things built in for no additional cost. So what you're gonna have built in is you're gonna have built-in drug coverage, typically for no extra cost. Not all Advantage plans have them built in, but most of them do. You're gonna have that built in, and then you're also going to have what they call extra benefits built in. So most of the time they'll have what they call dental, vision, and hearing. Most Medicare Advantage plans are gonna have dental coverage included, vision, and hearing coverage included at no additional cost. So it really is your one-stop shop type of plan to where you don't have to go and get a bunch of separate plans to be covered properly. Now, what I will tell you is there's two different kinds of Medicare Advantage plans. The first kind is what they call an HMO. It stands for Health Maintenance Organization. And what that means is if you go in network with an HMO Medicare Advantage plan, you're gonna be covered, everything's gonna be great. But if you go out of network with an HMO plan, you're not gonna have any coverage at all unless it's an emergency case and you go to the emergency room or urgent care first and then get admitted into the hospital. So not saying to shy away from an HMO plan, but a lot of people like to have the second option, which is what they call a PPO Medicare Advantage plan, because it offers a little bit better coverage. So what's a PPO? It stands for Preferred Provider Organization. And what that means is, same thing with the HMO. If you go in network, you're totally fine. You're covered, everything's great. With the PPO option, if you go out of network, you do still have coverage, but you're gonna pay a higher cost. But it does give you flexibility if you have to go out of network, that you will still have some coverage in place. So in a nutshell, that's what Medicare Advantage is. It's your one-stop shop. It's your all-in-one plan that you don't have to go and get a bunch of separate plans. Typically, we see healthy people get onto these types of plans because they can save some money not paying a premium every month and then just supplementing that with copays when they get things done. Maybe they just go to the doctor once a year, or they just don't want a lot of expensive premiums in their retirement. Now let's take a look at your second option, which is what they call Medicare Supplement. And if you're wondering why I'm writing in black now, my ink pen just ran out of ink while we were shooting this video. But in today's video, we're only going to discuss a Medicare Supplement Plan G. So what does that look like and how is it different than your first option, Medicare Advantage? Well, in Medicare Supplement, pretty much everything we just went over, throw it out. It's the complete opposite on this side. So a Medicare Supplement, you are going to have a premium. And depending on where you live, they start out as cheap as about $100 a month. And in some states like New York, Vermont, Florida, they can go up to $400 a month, drastically changing depending on where you live. So just like it's important to research your options on the Medicare Advantage side, it's extremely important to look into your options for Medicare Supplement as well. Now that being said, since you are paying this premium every month, you are not gonna have a bunch of copays like on the Medicare Advantage side. So you're gonna have 100% coverage after two things. One, after you pay this premium every month, and then you pay a one-time a year deductible, which in 2025 is $257. So if you take this option out, you know I pay my premium every month, and then I pay this one time a year deductible. I have 100% coverage no matter what. Doesn't matter if you're in and out of the hospital, you get in a car accident, you get diagnosed with cancer, you have 100% coverage after this deductible. Now it also differs from Medicare Advantage because it's what they call a non-network plan. So what that means is you're not gonna have a bunch of doctor and hospital networks that you have to stay within, like the Medicare Advantage side. You're gonna have a non-network plan, meaning you can go to any doctor, any hospital in the country that accepts Medicare. A lot of people like this option just because of that fact alone. They don't want to be limited on where they can go. If they're on vacation in Florida or Colorado, they want to get the same treatment as if they were at home and not have to worry about it. So if that's you and you plan on retiring and traveling a lot, Medicare Supplement is normally the right option to go with. because you need that non-network plan. Now, it also differs because there's no drug coverage included with the supplement. So what you need to do is you need to get a separate prescription drug plan to have your medications covered. Now, what does that look like? You need to go out and get a separate plan along with this plan to have drug coverage. And typically, I tell everybody to budget. If you're not on very, very, very expensive medications, budget about $0 to $20 more per month. Now, that can drastically change if you're on a bunch of expensive medications. It can go up to $100 or more per month. And then the last thing that it differs is you are going to have to, if you want these extra benefits, dental, vision, and hearing, you're going to have to get a separate policy for that as well. And I tell everybody to budget about $30 up to $50 more per month. I promise you, if you know this much by heart, Medicare, when it's time to enroll, is going to be a lot less confusing because you're going to know your options and then you can just research them and get on the best plan possible for your situation. Now, if you're still confused about Medicare or you're ready to enroll, feel free. I left a link down below where you can book a one-on-one call where we can go over both options in your area and we can help you enroll, whether that's into Part A and Part B, or maybe you want a Medicare Advantage plan or a Medicare Supplement plan. We can help you and take all the stress out for absolutely no cost. So if that's something you want to do, the link is in the description down below. Guys, thank you so much for watching this video, and I will see you in the next one.